All right. Welcome to the Healthy Hustling Podcast. I am Dr. Eric Broadworth. I am a physical therapist in Grand Rapids. And today, joining me, we have a very special guest. We've got the co-founder of Smart Tools, Dr. Nick Colosi. He's a chiropractor and he has been the man behind Smart Tools and the Smart Cuffs and everything like that. And I connected with Nick because of blood flow restriction training, which we offer the Smart Tools blood flow restriction training tool. They're 4.0 in our clinic at Fuel Health and Wellness. And we've just seen phenomenal results with that. I'm a huge believer in blood flow restriction training and implementing that into therapy. And I am so happy to have you on, Nick. And so that way we can educate more people on what is blood flow restriction training. For those who don't know, we can give a brief overview and why maybe some people need to be utilizing this and seeking out specific providers that are trained in this therapy. So thanks so much for coming on.
Yeah, absolutely. Thanks for having me. Yeah, that's great to hear that feedback from people, from customers, like yourself, using the product, liking it, loving it. That was the intention. When I started the company in 2014, that was the intention. I wanted to make products for clinicians, but also for just everyday people, non-clinicians that just want to get better, get rehab better, exercise better. That was the intention. So started the company in 2014. And then we got into BFR in beginning of 2018.
Okay.
So for those of that don't know, BFR stands for blood flow restriction training. That is basically taking a modified blood pressure cuff that's built to withstand exercise. You put it on the limb, whether it be the arm, so like upper arm, or on the leg, upper leg closest to the hip. And you set it to a set pressure, set limb occlusion pressure. We can get into that later. But elevator pitch, you're basically inflating it and then exercising with it under low loads. And you're kind of tricking the brain into thinking it's lifting heavier loads. That has been shown in the research to have phenomenal effects, and especially in regards to staving off atrophy, osteopenia, sarcopenia, and early stage
I'm
rehab.
sure it could help with osteopenia.
It can, yeah. There is some research, but yeah, that wouldn't be the, that wouldn't be the main, that wouldn't be the billboard, right?
Right.
So yeah, it's it has a lot of benefits, and it's nothing new. It's been around since the 60s and 70s, but it was very crude. They were basically taking
the Katsu bands where they died.
The Katsu band at the time, yeah, non-inflatable, taking basically a field tourniquet and putting it around the limb and then tightening it and then saying, "Hey, are you at a 5 out of 10 or a 6 out of 10 on a VAS scale?" That was pretty much it, And then up until about 2011, 2012 ish. The more automated things started to come about, and basically taking, things from the operating room, basically tourniquets, pneumatic tourniquets, and applying it to BFR, and standardizing it. That's the biggest thing. Standardizing BFR, standardizing a pressure that's personalized to that given user. That was the game changer, because you're now objectively knowing how much are you restricting that limb. To kind of delve into a little deeper as to what that is you're taking the cuff and you're inflating it with a pressure sensor built in. So like our cuffs, they all have pressure sensors built in, whether a 3.0 model or 4.0 model. They have pressure sensors built in and it's controlled by algorithms. So, and these have been validated. Actually, we're only one of 2 companies to be validated in research. Ours was validated by Mayo in 2021. Okay. So basically what we're saying, we're saying like if the unit says the LP is 220, it's validated and it's 220. Some products, they'll say that they're, they do personalized BFR and then the numbers are just all over the place. So, we took great pride in that, and it took a lot of time, a lot of effort, a lot of money to to get that algorithm right and get that pressure sensors to make sure that they're, what they're saying is accurate. So, for the, you put on the arm, inflate it, say, I want to exercise at 50% LOP, which is pretty much what we recommend for the arm.
And LOP, for those of you who don't know, is limb occlusion pressure. So that's the amount of pressure. Yeah, kind of going. So what'll happen is you stick it on the limb. We fill that cuff up, right, and then find out how much pressure is needed to fully occlude the limb, so we're not getting any blood flow to the limb, and then exercising, backing off of that and going at a percentage. So typically, for the arm, we're going up to 50% max, and the leg is usually 50 to 80% in that range there. Yeah, but that's amazing that, yeah, yours was validated through a third-party source, that you're getting the pressures that you say you're getting, because if they're lower, right, like, and if your range is all over the place, you're not going to get that therapeutic benefit or the intended benefit that you want with the exercise.
Exactly. And, objectively, being able to scale that, throughout your rehab process or your training process. So you have a starting point, you have a baseline. Otherwise, you're kind of just shooting in the dark. Our biggest thing is, then you're not running the risk of exercising under full occlusion, which can have some dangerous, there's some danger there. And that's the biggest thing with BFR is safety. And we take pride in, making sure people are using it not only correctly, but they're good candidates for BFR. Not everybody's a good candidate for BFR. And we tell this in our courses. I've told this to customers, and they've reached out, and I'm just like, no, you shouldn't be doing this. Like, this is not ideal for you. Right?
Who don't you recommend to do BFR? Who would you say you should probably stay away from this?
Yeah, I mean, the general is, if you're pregnant, don't do it. If you had a DVT in the last 6 months, don't do it. If you have peripheral artery disease, don't do it. Certain circulatory issues, don't do it. High blood pressure, if it's unmanaged, not a candidate for BFR. If it's managed, you can do it, but we recommend you doing it under a clinical supervision, being at a physical therapist, chiropractor, or something like that, that specialist in rehab.
And who would you say is like, who needs to be doing BFR? Who should be doing blood flow restriction?
Yeah. I mean, so BFR is it's evolved. So it really started with just early stage rehab, and that's bread and butter. And that's where it's been shown most in the research to be very effective. Early stage rehab, and you're loading these patients earlier. So when I say early stage rehab, I mean like ACL rehab, hip, mostly lower extremity, but you can do it. You can do it in the upper extremity as well. For elbow surgeries, shoulder surgeries. But predominantly it's been in lower extremity for the most part, for rehab purposes. And you're just loading those limbs earlier, and you're kind of preventing the muscle atrophy. That's really what we're going after. So you can get them loading with heavier load earlier. So it's a nice bridge. And we tell people, listen, this is not a substitute for, this is not going to replace heavy load lifting. This is not something that like you're going to do it every day for the rest of your life.
If you're a high level athlete, it's not going to replace like doing your 85%, one rep.
Absolutely not. Yeah. Even though the research will say that, maybe the hypertrophy might be the same, but there's a huge neural drive component with lifting heavy load that you're just not going to get with BFR. And that's why we don't recommend, replacing heavy load. That's crazy. But for our athletes and performance, on the performance side of things, we do have it programmed in like kind of like active rest days or deloading days, in season training, when you're, especially with football, you're taking an absolute beating. You're not going to be lifting heavy load during your off days. That's the last thing you want to be doing. So it's to kind of give your joints a break, but kind of maintain that muscle hypertrophy and strength. A lot of NFL teams are augmenting their off-season training. Their in-season training with BFR to really kind of deload the joints and kind of give the body a rest but maintaining strength and hypertrophy.
Yeah. Yeah, I've told my patients this, if especially you mentioned early stage rehab, if
Yeah.
you're having a surgery, like you 100%, and as long as you're not pregnant, you didn't have a DVT in the last 6 months, all those things, like you
Right.
100% should be and need to be doing blood flow restriction training. And my experience with the things that I've seen, I have not seen anything get as good of results with getting people back quicker with regards to improving the muscle strength, the hypertrophy, everything like that. And even then, the analgesic effect, the pain management. So it's going to be, I always tell them, it's going to be uncomfortable during. It's not
Yeah.
always super comfortable during it,
Right.
but afterwards, the effects are incredible. I've had surgery myself. I've had, unfortunately, I had a torn pec 3 years ago now, and then about a year and a half ago, I had umbilical surgery, and then a year ago, I had back surgery. And after all of
Damn.
those, been through the ringer a little bit. But after all of those, I implemented BFR, and it definitely helped with just trying to prevent muscle atrophy and things like that. Still got you still have a little bit of muscle atrophy just because, I mean, if you can't really use it, you're gonna lose it. But I mean,
Yeah.
I'd be in a sling for my because for the pec rehab, and I'd put the cuffs on the legs and train legs as well as doing some of my rehab exercise with the arms, just because I can't get under a barbell, right? So what's the best
Sure.
way to then train legs without straining my shoulder? And
Right.
yeah, it's a workout. It was really, really good and really beneficial. And um yeah, I think though too, what is the stimulus that people should be feeling with it? Um, I'll get some people where they're like, yeah, I went to therapy and they did some blood flow restriction training and we did 3 sets of 10 and it was okay. It wasn't too difficult. Like, what do you say? I guess what would you say to those people?
If it's not too difficult, they're doing it wrong, because it is just not is. And I tell people this: listen, this is not a therapeutic. This is not well, it's therapeutic, yes, but it's not a spa like treatment. You're not going to go to a massage clinic or something like that and have it just be relaxing. It's not going to be at a hotel spa. It is going to be relatively uncomfortable, to the point where you want this thing off after 5 minutes. Like, it is not something that you're just be like, yeah. Because I see people on social media using other brands I'm not going to say, but they got all limbs, like the upper and lower extremity has cuffs on it, and they're exercising for an hour. I'm like, there is no way on God's green earth you are going to, if you're doing BFR properly, there's no way you can last an hour. First of all, you shouldn't be doing all 4 limbs at one time if you're doing BFR properly.
No.
That you're restricting way too much blood
So
flow.
that's a red flag right there if you're doing all
Yeah,
four
you're gonna.
things at one time.
Yeah, then at that point, it's placebo. I mean,
Mhm.
I don't see. There's no scientific benefit or evidence to show that this having 4 cuffs on all 4 limbs.
Arguably dangerous.
Arguably dangerous if you're using a single chamber bladder cuff. Yeah, we totally advise against that. Yeah, so off my soapbox on that one, but yeah, it's if you're doing it correctly, which is the old is the it's 30 reps for the first set, then 15, 15, and 15.
Yep,
That has
75
been
total reps.
that's kind of like the rep and set scheme that was originally in the research. That has been modified over time. That's the standard, but is it going to be the standard? They just chose that because they almost guaranteed volitional failure. That's the only reason why they chose that rep set scheme. There's a new study coming out probably in the next month or so that's going to show that we're shortening that.
Yeah,
So
I saw. Are you talking about the study that Nicholas Rolnick had posted?
Yes. Yeah.
3 sets of 10 to 15 at 20 to 30% of one rep max.
Yeah.
Yeah, yeah. I thought that was pretty interesting that we can actually do a lot less reps, as long as you're using the appropriate, resistance with that 20 to 30% of one rep.
Exactly. As long as you're using the appropriate resistance and appropriate pressure. Because some people, they're not using enough pressure. And we're also starting to see maybe 50% is kind of like the sweet spot, regardless of the limb. So if you're using if your arm or a leg, 50% LOP sounds like a really good starting point. Maybe 65. We're starting to see that the 80% LOP for the leg may not be that much more beneficial than say 65 or 50.
Okay.
And if it's more comfortable with the lower pressure, obviously, and you're increasing the uptake by patients and they're using it more because it's a little bit more comfortable, that's a win.
Yeah.
That's a win.
Yeah, I would agree. You definitely need to ease people into it sometimes, like not sometimes, a lot of times, like if they're very sensitive, if they're not one of those people who it's like no pain, no gain, if they're not in that mindset, you need to start them off, in my opinion, and Nicholas Rolnick talks about this in his courses, but like doing the 50% and honestly just do like a fill it up, take it off, fill it up, take it off, and then add in some, aerobic training and then getting them up there so that way they can kind of get that feel versus boom, we're going to 80%, 30% of one rep max, and you are going to feel it. Like
that's one thing where we really address with the 4.0 model is that we wanted, and the feedback we were getting from the 3.0 is that some patients love it, some people don't. And with the 3.0, you can only do one mode of BFR, and that's continuous, meaning you're inflating the cuff and then it stays inflated during the entire exercise that you're doing. That's pretty intense. So in doing intermittent BFR and resting BFR, it was a little bit more difficult with the 3.0 because you only had one hose, it was very limiting. For those that don't know, intermittent BFR is inflating the cuff and maintaining, it's inflated during your exercise, and then you deflate it during your rest period. That is what intermittent BFR is. And then
are you going to get
BFR,
the same benefits with that as you are with continuous?
similar. You're going to get similar benefits.
Okay.
There's some research out there that showed that it was equivalent, and then other research to show that it was slightly lower.
Okay.
Is that slightly lower benefit at risk of the patient losing the patient entirely? No.
Yeah.
To the point where we recommend resting BFR to start. Resting BFR is you're inflating it during your rest period inflating it during your rest period and deflating it during your exercise period. So they're just exercising with a cuff that's not even inflated. They're just getting used to exercising with this thing around their arm or their leg. Because a lot of times the patients are sedentary to begin with, so they don't really do a lot of exercise, let alone exercising under, blood flow restriction. It's a lot to throw at them. So resting BFR is a nice kind of just undercook before you overcook them. You can always put that steak back on the grill. So you're really ramping them up. So the resting BFR, but then maybe that first session, just kind of getting them acclimated to it. And then that second session, and maybe for the next couple of weeks, get, intermittent BFR to where you're really getting them comfortable. And then if they want to go to continuous BFR, you can. We're kind of just pushing the continuous BFR towards our athletes and people that are using it for fitness, not so much rehab, because they're going to get more bang for their buck.
Interesting.
Okay.
Yeah. Okay, cool. And then, that's really helpful. So what would you recommend to for anyone who's out there who's not, say, a physical therapist and they're a patient, they're dealing with an injury, is there any specific provider that they should be looking for? So your brand is Smart Tools that you guys offer, but is there a way for them to see hey, this provider has the right training? And also, is there a way, are you seeing more people do this at home on their own?
Yeah. So for people that are actively looking for a provider, most providers are going to be physical therapists, athletic trainers, or chiropractors that are trained in this. Strength coaches, yes, but as far as for rehab purposes go, so we have a pretty robust list on our website of certified providers that have gone through our training.
Okay, cool.
There's other companies that have done training as well. I know, obviously Rolnick with the BFR Pros has training, has provider list as well. Those would be really good starting points as far as finding a provider. And as far as, if you're using it for non-rehab purposes, I get a lot of those too. They're just like, hey, we're just using this for training. It's a little bit more difficult trying to do education for training, just because that's very nuanced because everybody's different. So not everybody's going to be the same. So generally, we recommend using it as kind of like a finisher. So if you're using it for general fitness, say like, I'm not rehabbing an injury, I just want to use it just to get, bigger or just, increase my muscle size. You could totally do that. And how to integrate that, pick one exercise for that, whatever limb you're exercising that day. Say like it's biceps, right? Say it's a bicep day. You do your normal,
Routine.
2 or 3 bicep exercises. And then that third or fourth bicep exercise, that's going to be your BFR exercise for that day. We don't really recommend doing it. We don't recommend doing it every day. Say for like a muscle, say for like biceps, you're not going to do biceps every day anyways, right? But like, I don't know, maybe some will. I don't know, some meatheads out there. But like, you're maybe going to do it maybe 2-3 days a week tops, in a normal, strength training program. You can do BFR 1 to 2 days a week would be good. 3 days, totally fine. If anything, 4 days or more, you're really pushing it for that given muscle.
Yeah. So you could switch between, say, lower limb one day, upper limb the next day.
Totally. Yeah. Or the same day.
That's what I was doing with my like post surgery. I was doing like I do legs one day and then the next day I'm doing it arms kind of deal is how I was implementing it.
Yep. That's totally fine. Yeah. And I get that question asked a lot. They're like, how do I program it? I see that you only can use it maybe 3-4 days a week. I'm like, well, that's per muscle group. So you really, you can do upper and lower extremity in the same day if you want to, provided you're not doing it for like an hour for at a time. Like
20 minutes is pretty sufficient, like 20 or 30 minutes.
For aerobic, 20-30 minutes for aerobic. Strength training 5 minutes given the muscle group. After that, you're pretty fried anyways. You're going to want that thing off.
Aerobic with like calculating. So we go off of a specific formula and we'll try and keep people's heart rate there and keep them pedaling to keep their heart rate at that specific target level. And man, I'll start people 5 minutes with that because they're like, oh my gosh. And then we'll build to like 10, 15, 20, because it's pretty difficult. It gets pretty uncomfortable. So what are we seeing? We've talked a little bit about a lot of early stage rehab, post-surgical. What are we seeing with post-surgical, like difference of if they use blood flow restriction training versus they don't? Like, is there a long-term benefit between using cuffs early on versus not? And what's kind of that showing as far as even short-term versus long-term differences?
Yeah. Long-term, I mean, I think you're going to get to the end point regardless. It's just how quickly do you want to get there? And that's really, and that's in that, I don't know if I'm doing rehab, I'd rather get better in 4 weeks than 8 weeks or 8 weeks and 12 weeks. If I can trim off a month or two off of my rehab and get back to my normal activities, you're damn right I'm going to do that. I don't want to have to be rehabbing for an extra month or two. It's additional money. It's additional cost.
Time.
It's a time commitment, right? And it's just, so if I can shorten that, heck yeah, I'm going to do that. And the bang and the research is there. It's a great bang for your buck. This is not, no offense to Shockwave, but it's not $50,000 machine. There's some research there, but I mean, you're talking, BFR is under $1,000 for clinical, and for patients, we sell units for $299. This is something that it's relatively affordable for most, that you're going to get your bang for your buck.
Nice. And we'll provide some links for everyone too, if you're watching on like YouTube or anything like that, or even Facebook, LinkedIn, wherever you're watching this, check the comments or the description. We'll have a discount code for you for the 10% off of some cuffs if that is something that you're interested in. And then, one of the populations that we work with that's not necessarily the athletic population, the neuropathy crowd and the balance crowd and a little bit of the older population, seen some pretty interesting stuff there with people improving their overall balance, just simply walking with the cuffs, not even doing, heavy resistance training. What are you seeing there on your end?
Right. Yeah. Older population, definitely preventing muscle wasting for sure. That's been definitely documented. Increasing VO2 max with the geriatric population. Only really considerations with the older population is your screening has to be tighter. Make sure you're really screening these patients because they're going to be on a lot of medications. They're going to have a lot of different comorbidities and things like that. So you really want to screen them properly, but also their skin is going to be a little bit more brittle. So you want to make sure you're using the cuffs maybe over some thin clothing, stock nets if you have them. That's fine. We use neoprene lining, so I think we're one of the only ones that use neoprene lining. It's much softer on the skin. It's kind of like a brace. So it's easier on the skin. It's antimicrobial. But we still recommend it to use it over clothing just because it's going to protect the skin better.
Yeah. Yeah. We've been using it when they tolerate it. And like I said, as long as they don't have some of the contraindications and things like that, a bit with our older population and getting good results. Simply walking with them, sit to stands, things like that, where we can really help to improve their overall health and fitness and everything like that. I think we hit on a lot of really good things. Is there anyone else that you think that needs to be using blood flow restriction training?
I don't want to say that they need it, but I feel like the research is warranted to take a deeper dive into more neurological conditions with BFR. I know
which ones are you seeing?
Like cerebral palsy mainly.
Okay.
I feel like I get asked about that a lot. How's BFR integrating into neurological conditions, or I'll have universities reaching out and being like, hey, we're doing some studies on cerebral palsy and this and that. So that's starting to kind of heat up a little bit. So that's encouraging. Cool. Results are kind of mixed, just like with anything in the beginning stages of rehab, you're kind of seeing like, okay, what works and what doesn't.
Yeah.
So it's kind of too early to tell if it's effective or not for neurological conditions. But it's promising so far.
Nice. And then for the clinicians out there who want to get started in BFR, where should they look to? Where should they go to get started in utilizing this if they're not using it already?
Yeah, there's so many companies now teaching education. It's crazy. As far as for BFR, we were one of the, I think we were like maybe the third to do it back in 2018 to really, be in earnest doing education. At one point pre-COVID, we were doing almost 200 courses a year globally, for BFR. Obviously things have changed in the landscape of education since then. So we have level 1, level 2 online courses that are certification courses. They're 5 hours. They're on demand. We do live courses as well. Mostly these days, it's mostly private and semi-private live courses. We have education partners. Exos is our new education partner. We're launching that actually next month in conjunction with our USA weightlifting, the Olympic team for the upcoming Olympics. IAMT, Institute of Advanced Muscle Treatment. They are a partner, MedBridge. We partner with MedBridge as well. And then, Nicholas Rolnick at BFR Pros. Now he has a bunch of different products, not just ours, in his courses, he's very agnostic.
Yeah.
But he definitely loves our product, because it's research based.
I do love that with his course that he breaks down some of the different devices and uh, which ones kind of pros and cons to all of them, right? Just like with anything, like what's the best pro and con and stuff like that.
Sure.
Yeah. Uh, so I think that's awesome. So yeah, if you are a physical therapist or chiro, definitely check out all those resources. I did my dry needling stuff through IOMT, and I really enjoyed their dry needling course. I didn't know that you guys had partnered with them for
We
blood
just
flow.
did. Yeah. Their first course is the end of the month. So we just partnered with them. We've been talking with them for probably about 6 months now to get this
Okay,
going.
cool,
But we're finally launching it end of the month. Yeah. Craig O'Neill and Brandon Allison. Those are my guys over there.
cool.
Craig started it and Brandon kind of took over the education part of it. Um,
Okay.
but, uh, but yeah. So we work closely with those guys. Yeah. So, I mean, education is vitally important. Is it required to purchase the product? No. Is it recommended? Absolutely. Like
Mhm.
especially if you're using it for clinical purposes and you're using it on patients, you should be taking it.
We talked about this a little bit before, but one of the things that drives me absolutely insane, one, the amount of therapists out there that are not using BFR that should be, that are seeing people every day post-op or whatever, like they should absolutely be using BFR and they're not.
Mhm.
And then the amount of people that blows my mind that are using BFR and are not using it properly at all also
Yeah.
blows my mind. Like I had one patient one time who was a physician, and so she comes to me for some knee issues. She'd gone to PT elsewhere and
Mhm.
comes to me, and I'm like, "Have you done blood flow restriction training? I definitely think we need to implement that." She's like, "Oh
Mhm.
yeah, I've done it." I'm like, "Okay, like how was it? Like, was it difficult?" She's like, it wasn't too bad. I'm like,
Mhm.
okay.
Okay.
They didn't do it right. We're gonna
Yeah.
put, I put her through the first time. She's like, oh my God. She's just like sweating bullets. She's like, it was a workout. She's like,
Yeah.
holy cow. She's like, yeah, I definitely was not doing it the way that it should have been done.
Yeah.
And you're going to see that with the results. So if you're a patient, definitely look into your therapist on whether they are trained or not, which you can go to. If they are trained in smart tools, you can see the providers that are trained in smart tools on
Mhm.
the website there to screen them. If you're a therapist, you need to get trained in this stuff. I definitely recommend I took the BFR Pros course through Nicholas Rolnick. Highly recommend that. Um, he's just a great guy, and I think he has a really good course there. And there's a lot of other different avenues to get trained in it. You need to be utilizing this. And then I think my recommendation, if you want to use this, if you're not a healthcare professional and you just had a surgery or something like that, and you want to use this for your own injuries and rehab or training, um, get a pair for yourself. But I would say like run it by go to a physical therapist or chiro or someone who's trained. Just make sure that you're doing it right. Get a good program and just understand that how to do it to one, not only for safety, but to get best results. Like so you're not wasting your time on, am I doing this right? I'm not really sure, kind of deal. So
Yeah.
awesome. Anything else I missed on there,
No,
Nick?
I think you covered it. I think you
Awesome.
covered it. Just trying to grow BFR and trying to uh just dispel the notion that it's like unsafe. And it's just crazy how many people out there think it's not safe when it has an incredibly high safety profile. If you actually look at the research,
Mm.
the peer-reviewed research, it is incredibly safe if done properly. Just like with any other modality. So yeah, I mean, it's kind of dispelling that kind of thought process, that it's dangerous or something like
Yeah.
that.
But
Um,
it's
you
one
know,
of the things I love about it is how safe it is. Because it's very safe. It's extremely effective.
mm,
And I really think it's definitely one of the most bangs for your buck when it comes to choosing some sort of therapeutic modality or implementing it into your rehab. It's 100% one of the best things that you could do by
mhm.
far. So,
Yeah,
yeah, I really appreciate you coming on here today and
yeah.
doing
Thanks
this. I
for
hope
having me,
people
Eric.
found this
Appreciate
helpful.
it.
If you have any questions, if you're watching, please put any comments in the comments below. we're going to be putting this is on Spotify, YouTube. It'll be LinkedIn, Facebook. So if you have any questions, please put it in the comments below. Check out the description. If you do want a smart tools to start implementing it, you want 10% off, we got a link for you too. Check that out. And then Nick, if people do have questions for you or want to get a hold of you, what is the best way for them to ask you some questions, if you don't mind that?
Yeah, no. Emailing us directly to the website, by far the easiest way to do it. It's just a contact form. We answer all emails within 24 hours. So I try to leave my inbox unread, empty by the end of the day. So we answer emails incredibly fast, and that's by far the best way to do it. So.
I was very surprised at your quick response to emails. I will say that I try to do inbox zero myself, and that is a very difficult task. Is trying to complete inbox zero there.
Yeah.
Awesome. Thanks so much, Nick. I appreciate your time. You have a great rest of your day. Everyone, thanks for watching. We'll see you next time.
Thank you.
Bye.